Welcome back to FKB Physio Podcast. My name is Frances Brown and I am the owner of this podcast. And today I'm actually also recording this as a video format so that I can put it up onto YouTube. As I mentioned in the last episode I did, I was going to talk about my recent episode with low back pain and how I, as a physiotherapist who's also a powerlifter, managed that episode. So I have talked about it a lot on my social media, but it's nice to kind of bring it all together today, which is week 9 since I hurt my back. I have always had kind of low back pain, like more of an aching back pain while I stand, I'd say for as long as I can remember. And I think, back pain is a very common thing. 80% of people experience low back pain in their life. So really that is almost everybody. It's 4 out of 5 people. It often has this sort of connotation around it, like, oh, you've got back pain, like you shouldn't have back pain at your age. And I just don't really think that's true. It's part of being a human with a spine, right? So I always had this kind of aching low back pain. I had my first episode of acute low back pain in 2015, and it did happen when I started deadlifting. I was YOLO deadlifting, like I was going for a weight I'd never lifted before, and I did hurt my back doing that. And I have hurt it 2 times since then. So I hurt it in 2020 putting on shoes, and then I hurt it 9 weeks ago during back squats. When I look back on every time I've had back pain, as everyone's episode of back pain will be, it is a combination of factors. Some of those are biological, some of them are psychological, and some of them are social. So if you've never heard this concept before, it's called like biopsychosocial kind of way of looking at pain and injury. And it just means that, so if you looked at the whole picture of why I hurt my back. So the first time, yes, I was deadlifting. Yes, I was lifting a weight I'd never lifted before. So the weight probably exceeded the capacity of the tissues in my back. You could delve deeper and kind of go into factors like I wasn't working with a coach, so I probably wasn't managing my training load that well. I hadn't been doing it for very long. And I'd say most injuries happen in the first 6 months of doing something new when your body's not really used to it. My technique wouldn't have been that great. So they're sort of biological factors. Other factors to consider though, like psychosocial factors, were that I had had poor sleep that day. I'd already done exercise that day. I guess that sort of is a little bit in both categories. I was stressed at that period in my life. I had a lot of identity tied to my lifting performance that put a lot of pressure on it. All of these other factors were relevant as well. The second time it happened, there was none of that going on, but I'd had like a big weekend, not the healthiest weekend, accidentally drank more than I had in like a very long time, and like lay down a lot the day before. And then I'd also my training had been amping up lately. Like there's all of these different factors. And this time around I had changed my squat technique. We didn't back off the load, even though I changed technique. So it's going to load my soft tissues differently. I tried to squeeze in an extra squat session within a week. And I could tell that it was loading my back differently because I sort of was feeling it in different muscles, but I just, didn't change training when I probably should have changed the load. So they're kind of like, there were these factors that biologically made sense as to why I might have hurt it, like load management basically. But I also was incredibly stressed at that time. There was a whole lot going on. Sleep quality probably wasn't great. There's all these different things. And the reason those things matter is you are more susceptible to injury when you're under a high stress. But the other thing is that your nervous system is sensitive when you're stressed or you've had low sleep. So this time around when I hurt my back, I didn't feel a distinct pop or tear like I did with the other 2. It just started hurting. And this is an interesting distinction because when I even struggle to say that I injured my back this time, because I developed back pain while I was squatting, but an injury to me kind of implies a tissue was pushed past its capacity and like it broke, like it damaged, it tore, like something happened to it. But because I couldn't feel that distinctly happen, and because I've injured this exact same place 2 times before, you actually don't really know, like, did my tissue get injured per se? Like, did the actual integrity of the tissue, was it disrupted? Or did my nervous system just give me a warning signal before I'd actually damaged anything to say, hey, back off? And that is a real thing. Your nervous system is there to protect you. So we are amazing. We evolved to live as we do today. And in order to evolve successfully, we needed these signals in our body, like these alarm systems to go, hey, you're in danger, run, basically. And those systems can be really, really helpful, and they can also be unhelpful. And you could argue in this case for me it was helpful. Like my nervous system gave me a warning signal possibly before an injury even happened and told me, don't keep doing that thing. I think all these little distinctions are important, probably because it will affect how the rehab goes, and it will probably affect the sort of psychological response afterwards. So when I heard it the first time, I heard it while I was deadlifting. I felt this huge pop. I'd never felt pain like that before in my back. I was terrified, and it took me almost 2 years to deadlift that weight again. So it gives you a bit of an insight into how much it freaked me out. And I sort of thought about it constantly all the time, like when I was training, not in normal life, even though it never hurt again, which is quite interesting. And just to side note, my back pain has been overall much less day to day than it was before I started strength training. So as a whole, the strength training's made my back feel way better. The second time when it happened, because I bent forward putting on my shoes, that traumatic response was not there because I wasn't doing a big heavy deadlift and I didn't feel this big snap. I would just bent forward and I felt this kind of tear. That was way less traumatic, and I managed to get back to like max effort squats and deadlifts within 7 weeks. And this time around, it's sort of a bit of both. So I didn't have the big scary pops feeling, but I did develop the pain while training, which hasn't happened in 7 years. And just to kind of hone in on that point, because people, like a lot of people I've told, like, oh, well, then why are you still training? Why are you still lifting? And it's sort of like, because I train like 5 to 6 days a week, every single week. And out of all of those training sessions, my back has hurt on 2 of them in 7 years. Like, it's not exactly bad statistics. It was probably going to hurt anyway, because all the patients I get coming through the door who develop back pain doing not much, like, do you know, it's kind of going to happen either way. And as I said, I feel much better overall in my back for having strength train. But yeah, it's interesting that sort of the psychological side of it will dictate how you respond later. So this time around, I'm just going to talk about this experience now. It hurt badly when it happened. Like I sort of stood up from a squat and the pain intensified over the next 5 minutes, I guess. And it hurt mechanically, which to me, I mean, it hurt to bend forward or back. Like it felt like someone had kicked me in the back almost. That honestly only lasted for 24 hours. And then it gave way to this diffuse ache on the left-hand side, which I actually was watching some of my Instagram stories back from a few years ago when I did it last time, and the exact same, it was like basically the exact same thing. That one had the mechanical pain for longer. This one was honestly only 24 hours, which gives more weight to the idea that I hadn't actually really hurt anything. It was just a bit of a warning. But that diffuse ache on the side, it's very interesting. And to me, I really think it's sensitivity of the nervous system more than anything, because it's not pinpoint. I couldn't touch a point that hurt necessarily. It was quite a wide area on my back, and it was non-mechanical. Like it didn't matter if I bent forward, bent back. It just got worse as the day went on. So it sort of, I woke up and it felt fine. And then as the day went on, it would get sore. And I guess that sort of neurological sensitivity, or there could have been a bit of inflammation. Inflammation sort of gets worse, like with load and use. And then I had pins and needles and tingling down my leg, which a lot of people, again, they panic at that. It's not always cause for panic. If you hurt your back and you've hurt a structure in your back near a spinal nerve and it gets inflamed and that inflammation affects the nerve, you're going to have those sort of symptoms. So there's this thing called a dermatome, which is basically the area of skin that your spinal nerve supplies. And so I could tell from the area on my leg probably where in my back I'd hurt, and it did link with the place that hurt. So it's like on the outside of my shin and down into my little toe, there's the most faint pins and needles feeling. It didn't hurt. It was like pins and needles, kind of like a flash. Sometimes it's like ants running down there. So I heard it on a Thursday morning. I stopped squatting because it would hurt, but I kept my training session. I did everything else. It was like a sore, but not a big deal. And I did go and get some painkillers straight away. I went and got some Panadol and Nurofen, and I took both of those. And I taught Body Attack that night. And like, again, it hurt, but it wasn't like that bad. And then, like I said, 24 hours later, it had made way for this sort of pain on the side that wasn't that bad. I think it's really important when you hurt yourself, and especially if it's back pain, to try to keep your life as absolutely normal as possible around that pain. So you don't want that pain to take up lots of space in your life, because the more space the pain takes up, the harder it is to get better from, because you and your brain will perceive it as more of a threat. And the bigger of a threat it is, the worse it will be. And whether that means it actually feels objectively worse, or whether your ability to cope with it is less because it's taking up so much space, like it's sort of this vicious cycle and you don't know how much one's affecting the other. But it is really important to try and just live your life as normal around the pain where possible. And I do fully understand that if it was incredibly, terribly painful, this is very hard to do. And I do often think about how I would cope if it was like that. But I do still think that the general idea is correct. And Adam Mickens, who is a physio who had a very bad episode of back pain, sort of documented his own experience. If you check out his social media, he's talking about the same sort of things, but his was much harder than mine has been, I must say. So I basically just made sure I did everything as normal. I still went to work, I still went on walks, I still did holidays, I did all of the things. I just modified my training a little bit around it. That pain that was there on the side, it honestly came on every single day, and the pins and needles were there intermittently every single day, and those symptoms did not get any better until week 6. So they actually even got a little bit worse around week 4 and 5, and it didn't really matter what I did. So I happened to go on holiday in that time, so it was good because if I'm in Brisbane, I'm going to train in the gym. I never don't go to the gym. So I actually had this unique opportunity to compare, okay, what's it like on a gym week compared to a holiday week? And if anything, the pain was worse on the holiday week. I don't know why, but it was good kind of evidence to go, well, actually, even if I wasn't training, this is still going to feel really bad. So in those first 6 weeks, I often say to patients, like, look, your pain's probably going to get better on its own, but it will take time. And I guess, like, as a physio, I'd often see people at like week 1, week 2, week 4 kind of thing, and I ask them how you're going. And I guess even though I know that things take time to get better, I often get a bit stressed if they're not feeling better at 4 weeks. But my experience was that it truly didn't feel better until 6, like not even at all. Like the first day where I'm like, oh, I didn't think about my back today was probably week 7. And that's how it goes. Like it was just this day, I'm like, oh, that's right. Like I didn't notice it today. And there were some days there where it was pretty sore. Like it'd be sort of 5 p.m. I'd be at work and I'm thinking, like I'm so sick of this hurting. And I think what's really important in those times is to have something you can do to get the pain just to a bearable level so you can keep going. So for me, I knew that sitting down would make it feel better, which is funny. Like this is why you can't rely on generic advice from like YouTube or the internet or whatever. The most common piece of advice I give my back pain patients is to walk and to reduce sitting. Well, my back pain felt way better to sit and way worse to walk, which was quite surprising to me. So that's fine. My personal experience was that it felt good to sit. And I knew I had Panadol up my sleeve. And if the Panadol didn't take the edge off enough, I had Nurofen. And this is another point I wanted to talk about. A lot of the time, people are very hesitant to take any pain relief. And you get these people, they're coming in and they're struggling. And they're like, my back is so sore. And I'm like, okay, like what pain relief are you taking? And they're like, oh, no, like I don't take anything. I don't like taking painkillers. And I'm like, I fully get it. Like I'm not here to like pop an endone or something, but if you have extremely bad pain, taking some over-the-counter painkillers is not a bad idea. And obviously you need to check, especially with Nurofen, if it's safe for you to take that. But those things can be quite effective. And I think at the very base level, if you're in pain, try taking some over-the-counter painkillers. I don't think there's anything like morally or medically wrong with doing that. Over the time of having this constant back pain for 6 weeks, I probably took 20 Panadols and 6 Nurofens. I think I'm more careful with the Nurofen because they can kind of hurt your stomach lining. I'm fine with that. Like I never take those things normally. It helped me get through, and it meant that there were no days where I thought I can't cope with this. I think that's just such an important concept to keep in the back of your mind when you're trying to get better from an injury. You are going to get better. Your body is going to heal. You just need to give it an opportunity to do it, and you need to be able to cope while it's doing it. And some over-the-counter painkillers might help you cope. And I guess the thing that I also think will help you cope is keeping your life as normal as possible around it. I think people often go, oh, well, I know this relative who needed surgery, and they're very scared that will happen to them. I fully understand why that would be scary. Again, I challenge this idea. I think people often see surgery as the end goal. Like it's sort of like, I'm going to try physio or try it getting better naturally. If it doesn't work, I'm going to go for surgery. And if you recognize that for many things, especially pain, surgery does not have better outcomes than exercise or time, a lot of the time, it stops putting it on this continuum of, I'm going to try this, and if that doesn't work, I'm going to have surgery. Because if the outcomes of surgery and the outcomes of exercise are quite similar, they're both just different treatment options. It's not, I try this, and if that doesn't work, it's this. So for me, I go, well, surgery is about as likely to work as exercise. And in time, either of those things are likely to have a good outcome, except one doesn't have the risks of getting sort of a surgical intervention. It really changes how you see it in your mind. And so the other thing is, like, when people have surgery, you don't know their story. So it might be that your aunt had back pain, and for whatever reason, for her beliefs, her experience, her life at that point in time, this random aunt I've invented, but she couldn't cope with that situation and she opted to have surgery. That is quite different to, my aunt's back was so bad she had to get surgery and I'm scared that would happen. It's, for my aunt's specific situation, she chose surgery. So it is a distinction to make. And I especially think this is true for back pain, because the surgical options for back pain are not as evidence-based as you'd hope. And if you read the evidence-based guidelines for low back pain, the guidelines basically state that things like injections, surgery, massage, mobilizations, all of those things, they're not really any better than anything else. And that basically waiting for it to get better and managing possible barriers is the key. So when I talk about how my back got better, in my mind, I'm like, well, I did nothing. I just waited for it to get better. But that's not really true. I made a conscious effort to make sure my life didn't change around my back pain. And as I am someone who trains in the gym, I did sort of recondition my back. So I do think that if you've hurt your back, those tissues in your back lose a bit of capacity to handle load or doing stuff. And it makes sense that you might need to reload those tissues progressively, whether that's to actually make the tissues stronger again or tone down your nervous system to go, hey, it's okay to load these again. Both of those things are valid. If you are someone who trains in the gym and you kind of back off things that hurt and slowly bring them back in, to me, you are addressing the capacity of your back tissues. If you're not someone who does any regular exercise, I would tend to give some exercises to my patients to gradually reload their soft tissues in their back. But as I say, because I already do exercise, I didn't really do any of those things myself. I do think that if you're struggling with the idea of just kind of waiting it out, absolutely seek help from someone who has this sort of ideology that you're going to heal, but you just need to give your body the best chance to. Because of course there'll be moments of doubt in there where you're worried that it might not get there and you might need some reassurance, or you might have inadvertently started moving differently or doing things differently, and you might just need someone to check in with and go, hey, like, I'm at week 3 on my back pain and this has happened and this has happened, and like, can we just sit down and chat this through and maybe come up with a bit of a strategy so that when I have a flare up I can manage it. Like, that's, to me, like, that is what rehab for back pain is. And because I felt like for me at this time I kind of had a handle on those things, I didn't really need to do anything else. If it was worse, I probably would have seen my physio colleague, Lewis, hello. But luckily for me it wasn't. So people might sort of go, okay, well, why didn't you get an MRI for your back? So basically, you should only get an MRI or imaging for your back pain if to rule out serious pathology that needs emergency medical attention, like a malignancy or a fracture or a disc injury that's so big it's actually like cutting off nerve supply, like your legs lost power or you're losing bladder and bowel control. Those things absolutely need an MRI right now. You probably need to go to emergency. Most cases aren't like that. So even though I had pins and needles and tingling down my leg, I didn't have loss of power. An MRI doesn't tell you why you're in pain. And it also should only be used, aside from ruling out serious pathology, to dictate further treatment options. And I know that I wasn't going to do anything other than what I was doing. So there's no need to get an MRI. They can be quite scary. They can change how you move inadvertently because you're scared of what you've seen in there. They cost heaps of money. And it's not the perfect science you'd think it would be. So the first time I had back pain on that side in this acute way was in 2015. I could get an MRI at that point. It might show left-sided stuff in my back. That might have been there before I started feeling pain. It might still be there in 2018 when I didn't have back pain for years. You know, if I got an MRI now, it might show that historical stuff, And I don't know whether this flare-up of back pain is because of maybe a disc bulge that has been there for 7 years, or it might be a new disc bulge. Like, you just don't know. So you'll find people get an MRI that shows, so let's say 5 different abnormalities. There's one that correlates to symptoms, and they'll go, oh, well, yep, you have back pain because we saw this disc on your MRI. But you might have another disc bulge at another level that's on the other side, but they'll go, oh no, it's not that one, it's this one. And it's like, it's just, you can sort of see just from that how it's not exact. I do think in my case, like, you probably can assume there's a disc something going on because I do have those symptoms down my leg. But in between those episodes of back pain, I have no symptoms, and I can deadlift really heavy and I can back squat really heavy and my back doesn't hurt. And heaps of people out there have those things in their back. They never know about it. Like, there's no real need to know. And like I said, it won't change the management. So I didn't get one for those reasons. So to talk about how I modified my gym training around my injury now, for those of you who are powerlifters listening. So I didn't back squat or deadlift for 7 days. I think I introduced deadlifts on day 9 because they didn't hurt, but I was pretty careful. I did like pretty high rep, didn't go near 1RM. I brought squats in, I think, on about day like 14, light. And I just sort of slowly crept up the weight on both. Like, I do both squats and deadlifts twice a week each at the minute, like a higher rep day and a lower rep day. I just put the reps even higher. So for back squats, I've been doing sets of 5 and 7. And for deadlifts, I've been doing sets of 5. I was doing sets of 5. And then as it got a bit better, I sort of introduced a top set of 3 on the deadlift day and put like a beltless day because that was in my program anyway. And I just slowly increased the weight as I could. And I found like with the deadlifts this week, I did like a triple, maybe at the heaviest weight I've ever done, and it felt totally fine. I've been much more careful with the squats because I'm quite scared of those still. You know, doing 7 reps, it's actually about as heavy as I was doing before my last competition. So mentally, I find it easier to sort of deal with it feeling heavy because I'm tired rather than it just feels like incredibly heavy. Like, I am really scared of doing a really heavy back squat and it just going. Like, I didn't have the pop when I had it this time, but I can remember the pop from the other times, and like the pop is traumatic and I don't want that feeling. So I've just been sort of easing in, and I'm not going to do a really heavy back squat until I'm just not worried about that anymore. And I guess that will probably happen through expectation violation, which is like me continuously training and it not hurting again. I had to be careful on the leg press because that's always felt really bad. And it's that same thing, like when you've got 2 feet planted and you're moving over them, it does like move that lower lumbar joint. Like, I'm assuming that I hurt L5S1 or L45 because that's where the symptoms are. And those sort of joints move the most when you're like moving your pelvis over fixed legs. So leg press sort of is that exact thing. So I just did it staggered, like 1 foot on and the other foot lower, and made it lighter. I think I was able to tolerate a double leg one quite light at about week 4. Everything else I did exactly the same. And just something to know is that, like, often if you have back pain, you can manage split leg exercises like Bulgarian split squats or lunges. They're often fine. So if you're trying to train around back pain, most upper body exercises are going to be okay, and then you can use split leg stuff. So I wanted to do a bit of a summary of the things that I think are really important in low back pain rehab first. So number 1, try and live your life as normally as possible around your back pain, and try to make that pain take up as little space in your life as possible. Number 2 is to believe that your back's going to get better. You just have to kind of give it a chance and have some strategies that you can implement that you know will help get the pain to feel a little bit better, just so you can cope on the worst days. I think that it's important to restore movement and loading capacity to the injured area, which basically means you want to be able to move your back in all directions and bend over holding weight and squat holding weight and do all the things. And 2 things might stop you doing that. It might be your tissues lost a bit of capacity to handle load from a structural integrity perspective. You might have lost the ability to handle load from a nervous system protecting perspective. You do need to get it to be able to do the things again. If you're someone who exercises regularly, it's probably going to be possible from your regular training. But if you're not, you might need to see someone to get some sort of specific movements to do those things with you. And then the things I think are not so important in low back pain rehab are the stuff you see on social media the most. So I don't really think manual therapy is necessary for low back pain rehab. if you've bulged a disc or torn a annular tear or whatever, you can't push those things back in with your fingers. A chiropractor can't crack your disc bulge back in. A physio can't push it back in. That thing is in there. It's deep. You can't get to it. It's going to get smaller in time, or your body's going to adapt to the fact that it's there. You don't need manual therapy to get better. And I could argue that like constantly digging around in an area that's been recently injured draws more attention to it. It can actually maybe be a barrier to getting better. All of that said, if you're in pain, like if I have patients and they're in pain and they're struggling, and getting some manual therapy makes them feel better for like a day or two, I am all for it. If that's what they know that it is. It's like the same as me taking a Panadol. It's just a way to sort of tamp it down for a few days, but you don't need to do it to get fixed. I don't think that endless mobility exercises are important in low back pain rehab or prevention. So a lot of the time people will add all these extra like mobility exercises to their program, and I sort of think lots of the time, especially if you're like a weightlifter, like a powerlifter, like someone who lifts weights in the gym, lots of the time, and back pain comes from a training load error. Like it comes because you did too much. So you might have done too heavy for what you're used to, or you might have gone heavy too many times in 1 week, or you might have done too many exercises in a row that load the same body part. Like it might be like you did squat and then deadlift and then leg press and then bent over row and then double leg lowers, like all in the same day. Or you did all of those in the same day and then the next day you sat down for 8 hours at a course. Or you did all of those things plus you hadn't had enough sleep. Whatever it is, the load hasn't been managed. No amount of stretching in between sets is going to counteract that. Like I think people think, oh, well, I did a heavy squat, but then I did like a stretch in between sets, so I negated that heavy weight I lifted. Unfortunately, it doesn't work like that. The load's going through there no matter what. Stretching won't reverse the load that you've put through. So I basically think the things that are most important is the mindset, I guess, and looking at your training load and being aware of the psychological and social factors that can feed into back pain. And I think the things that don't matter is mobility exercises, manual therapy, stretching, those sorts of things, but with a little bit of a asterisk on those because they can have a place. For people that I don't think move enough, I often put mobility in because it's at least a way to like get them moving and get them to feel like moving their back is safe. So that's my story about my recent back pain experience. My next episode is going to be a rehash of the Instagram live I did with Alex, the Pilates instructor from Perth. Pilates instructor and physio from Perth. So if you're someone who's interested in Pilates, or if you're like me and you don't really like Pilates and you want to hear a different perspective from a very impressive lady, then definitely tune into the next episode on FKB Physio Podcast with Alex.